I am Pocho Salcedo. Greetings to our viewers and content distributors, TV stations in Latin America, and those tuning in from coast to coast across the continental United States and Hawaii. Here in New York, we are ready to decode the stories that shape our world. This is not just the news. This is the DNA of the news. Today, we will discuss a growing concern, social media's impact on mental health. Social media has become an integral part of our lives, but its influence on mental health is profound and multifaceted. Not all is bad, but it's problematic enough that, for example, the Surgeon General of the United States is pursuing legislation to add warnings like those we see on cigarettes or alcohol for minors accessing social media. To discuss and explore this important topic, we have invited an expert on the matter. Professor Emily Hemendinger, welcome to the show.
Happy to be here. Thanks for having me.
Emily Hemendinger is currently an assistant professor and clinical director for the OCD and anxiety programs at the University of Colorado, Anschutz Medical Campus. Emily completed her dual degree program, Master of Social Work and Master of Public Health, from the University of Pittsburgh. She has over 12 years of clinical experience working with OCD, anxiety disorders, perfectionism, body image concerns, and eating disorders. Emily has a background in behavioral and community health sciences, health education, and health promotion. She is dedicated to combining her mental health and public health work to increase access to affordable and inclusive specialized mental health care.
Emily, you recently published an article about the growing concerns over the effects of social media on mental health and teenagers. Teenagers are perhaps the most vulnerable to social media as negative impacts. During adolescence, individuals are in critical phase of development. Their self-identity and self-esteem are impacted by social media platforms. Tell us a little bit about what are your concerns in that respect.
Yeah, so I think you're right in that adolescence is a time of immense growth and identity formation. There also tend to be a number of mental health conditions that are more likely to develop during that time period, including, eating disorders and depression and anxiety disorders. And so adolescents are more prone to developing some of these disorders, and social media can really impact that in the way that in what they're viewing on their social media feed and who they're interacting with. There's also bullying that can happen over social media and a lot of hateful content out there that people, especially teens, might consume and can really impact how they feel about themselves.
What are some of the most common mental health issues you have observed in teenagers that you can say are directly linked to social media use?
I don't know if I can say anything's directly linked to social media use. I can confidently say that social media is a contributing factor to worsened mental health that I'm seeing. So while the research still needs to be, more and more research is needed on this, there is, from my clinical practice as a therapist, what I'm seeing is this is contributing. It's not helping mental health. It might help in some regards of helping people feel like they have a sense of community, but ultimately I'm seeing people feel depressed because they're feeling like they're not doing enough, or they're comparing themselves to what their peers are doing or what their peers' relationship is like. I'm seeing anxiety, fear of missing out. I'm seeing lots of appearance and body image concerns and dislike and dissatisfaction. Just a lot that social media is not helping. I even see people who get a lot of their news from social media and they're just kind of doom scrolling. So they're just scrolling and looking at all the terrible things in the world and feeling worse and worse, but they feel like they need to consume it. They want to be informed, but it's just making them more anxious and more depressed.
So we are kind of focusing on this part of our conversation on teenagers, but does it extend also to other age groups, this type of issues?
Oh, yes, definitely. I treat people 13 years and up, like up into their 70s. And while I'm seeing it mostly in teens and young adults, I'm seeing it in adults too, especially some of the comparison aspects of comparing where people you went to high school with are at in their life versus where you're at. And it just leads to constantly feeling badly about oneself.
You just mentioned the constant comparison on social media affecting teenagers and adults, and the issues of self-esteem and body image. At one point, reading a little bit about your background, you also were dealing with body image at one time on a personal basis. Was that induced by social media, or was a different phenomena?
So for me, yes, I am 16 years recovered from an eating disorder. And I will, just like I said, before, it was certainly not helpful. And social media was at the very beginning. I had a MySpace, and it was before Facebook, Instagram, all that. So I feel like it's probably 10 times worse now, but it certainly wasn't helpful. There were tons of communities and message boards that were they're called pro Anna or pro Mia, so pro anorexia, pro bulimia, and they're communities where people support one another in having an eating disorder. So that was something that definitely was not helpful and kind of reinforced my eating disorder and hindered any efforts at recovery at the moment.
And what was the one thing that clicked for you to be healthier vis-a-vis social media, for example, or images that were coming from commercials or anything that you were visually being impacted by?
I think other than the amazing support of my family through all of that, I think something that helped me was shifting my perspective that social media is not the full picture. And that anything that the eating disorder was doing for me, because eating disorders are maladaptive coping skills, anything it was doing for me was not worth what my life could be without the eating disorder. So without the eating disorder, I got to be able to travel and go to college and do so many amazing things that I would not have been able to do. And so for me, if I have moments of negative body image, I remember all that's at stake, all that I could lose if I were to go back to an eating disorder. So I think for me, having that perspective of that big picture was really helpful.
Thank you very much for sharing that part, and really so meaningful to all of us, because you're not just sharing from a clinical point of view, but also from real life experience. And there is another dark side of social media that we hear a lot, the interactions that lead to cyberbullying and the effects on everybody from teenagers all the way to politicians, if you want to extend it that way. Tell us a little bit why cyberbullying bullying is so insidious.
Yeah, well, it happens so much because it's a way for people to say these terrible things to one another without actually identifying themselves a lot of time. You can post almost anything anonymously, and the likelihood that you would say that to someone if your name and your actual picture was attached, or if you were seeing that person in person in real life, the likelihood is you probably wouldn't say that. Half the stuff people say on the internet, they'd never say that to that person face to face. And so there's a sense of disconnect to our humanity when we're commenting and things like that. And people are more likely to do that because there's that illusion of protection, of I can say whatever I want with no consequences, which is not the case because what they're saying is really hurtful to the person on the other side.
Thank you. What are some signs that parents and educators should look out that might indicate a teenager is struggling with mental health issues due to social media?
I think noticing how much time they're spending on it. I think the recent studies have shown that it's quite a lot of time that adolescents are spending on social media. And so I think like recognizing how much time is being spent. Are they getting upset and dysregulated if they're not allowed to use social media? I would recommend that you're not like taking it away and making it a punishment, because adolescence is a time of rebellion. So saying don't do that is going to probably have the opposite effect on a teenager. And so, having open conversations with, children and adolescents about their social media use, about what it looks like to have a more mindful, intentional relationship with social media. I think like other signs are if the adolescent is isolating themselves or constantly saying negative things about themselves, those are things to look out for. And again, have an open conversation with the person. Don't just like call them out in an accusatory way. Be curious.
So in your practice, you see teenagers and you see people of different backgrounds and ages as well. What advice would you give to teenagers who feel overwhelmed by the pressures of social media?
Yeah. And I guess I see all the wide age range backgrounds, all of it in my therapeutic practice. And what I talk to them about is really just like a few things. One is like, what are your values in life? Are they to look a certain way or appear to have a certain type of life, or do you actually want to be engaged and an active participant in your life? And I also remind them that what they're seeing is not the full picture. Like I talk to them about the picture of the happy couple that is on a beach, but meanwhile, maybe that right before that they were arguing, but we don't see that. And so we talk a lot about what are some alternate stories to what you're telling yourself about these people, and like, are you seeing the full story?
Well, just in closing of this segment, in the couple of minutes that we have seen congressional hearings with media companies. What do you think social media companies should play, and what role they should play in mitigating the negative impact of their platforms on teen mental health, for example? And we have the Surgeon General advancing one of the proposals.
And the Surgeon General, calling for warning labels, I think, is an initial first step. It's not the fix. I think the fix comes from improving our mental health system and improving access to mental health care. And because social media is a contributing factor, the warning labels would serve as a form of education to the people consuming it, just like with cigarettes. And so it is a good first step, but if nothing comes after that, then there's not going to be change.
And the responsibility of the social media concerns companies, do they should have some role in resolving this?
Yeah, I think like it should be an active collaboration between consumers and stakeholders and the social media companies so that they can at least get on board. But I think there definitely needs to be a collaboration between a number of groups to make these changes actually happen.
Emily, thank you very much. We will see you on the other side of the break.
Sounds good.
We are back. Emily joins us from Aurora, Colorado, here in the United States of America. Emily, we live in the most technologically advanced society in history, but loneliness is a growing problem and growing at a very alarming pace. Can you explain the difference between social and emotional loneliness and how social media impacts each type?
Oh, so I think like when it comes to loneliness, you can have lots of people around you and be like socializing, but you can still emotionally feel pretty lonely because maybe the quality of your connections is not deep, or maybe you're focusing on being on your phone and not truly engaging with others. And so that's how I kind of see like social loneliness versus emotional loneliness. Like social loneliness, I think of as, you're not around anybody, you're on your own. And emotional, I think of as this more chronic type loneliness of feeling like you never fit in, being in a crowded room and not feeling, and still feeling alone. And so I think, yes, with that, social media, while it can really help build communities and connect people, more maybe socially even, it's emotionally, what I see in my clinical practice is that people are not feeling connected. People are still feeling really lonely because they're not being with people all the time, or they're not feeling like these are deeper relationships.
As you indicated, despite being more connected through social media, why do you think the rates of loneliness have doubled since the 1980s? What is happening? You have grown in the age of internet, so you were at that stage from the beginning. So why do you think the internet has kind of brought us together, but not really?
I think like that's the big question, right? I think there are lots of people, especially, like I'm able to remember a time before the internet, but there are so many people now who never lived without the internet. And you're right, it does connect us in a kind of sense that we can contact people pretty quickly and comment on their post really quickly, or email them, even if they're out of the office on vacation, right? But we're not having those conversations. There's a lot that's being misinterpreted even. Think about like sending an email and you might be implying one thing, but someone completely misinterprets your tone and thinks you're being kind of mean or being a micromanager. I think there's a lot of that's happening. There's a communication breakdown when we're just communicating virtually. And so we're not having those kind of deeper connections that might happen when you're in a physical space with someone.
What do you think we should have learned from COVID and the time that we were so socially connected but physically disconnected? What have you observed, and what lessons should have learned, and what lessons we did learn?
So I think what I've seen as a result of COVID is I really have seen a bigger gap between introverts and extroverts, if anything, that has become more pronounced since COVID. So, I think these terms get thrown around a lot, but what it means, extroverts are people who like being around people and feel like energized by being around people. That doesn't mean they don't like their alone time, but they feel happier and more energized when they're around people. Introverts are people who, they're not antisocial. They like being around people, but it's depleting. And so they recharge by spending time alone. They do better in smaller groups. They might feel that big parties are not their thing, and having like 2 or 3 good friends is what helps them feel less lonely. So I've seen a big, more pronounced gap between the two, because during COVID, people who are more extroverted weren't around others and they were trying anything to find connection. And that social connection virtually was not really doing it for them. And so now that we're reconnecting, they're really thriving and wanting to do more and more. And what I'm seeing with people who are introverts, like myself, is that it's more acceptable to not go out and do all the things, because even though it was hard to not be around people during COVID, there was something really recharging or re-energizing about having all that time to recharge. And for me personally, I think I've been able to recognize how draining, like going into the office and being around people and constantly being on is for me compared to like pre-COVID. I had no idea how much energy was going into like being around people. So that's the real thing that I've seen. I also think that regardless, introvert, extrovert, that social connection in any form is better than no connection. And I think COVID was something that really caused a lot of people to feel disconnected. And that's why we're seeing a lot of mental health issues too, because people were feeling extreme loneliness.
Thank you for bringing those issues. And how can individuals use social media in a way that might help reduce feelings of loneliness rather than exacerbate them? How can we use positively social media?
Yeah, so I think one is finding communities that you feel like you can belong to or that are open and understanding and welcoming. There's a lot of communities out there for on social media for people who have ADHD or people who have OCD or autism, and that really can create a sense of community where maybe outside that community there's a lot of misunderstanding and there's certainly a lot of stigma around some of those diagnoses. And so there's that. And I think the other piece is recognizing again that social media is just a snapshot. Like I think what feeds into the loneliness is that comparison piece too of my friends are all getting together and I wasn't invited, and they're all doing so many things. They have so many friends. They must be so happy. That's just going to make us feel worse about ourselves. So recognizing that like we don't know what that person's going through and they might not be completely transparent with how lonely they're feeling. So I think bringing the focus back onto yourself and really following accounts that you feel good, like interacting with, and unfollowing accounts or unsubscribing from accounts that don't make you feel so great.
You teach young people, you treat teenagers. What is that disconnect between parents and younger people? Because in my age group, for example, we cannot imagine the challenges of social media because we never had it when we were young. So most likely we fail to understand the challenges that younger people go through as they interact in social media.
But I think, yes, it's different because people these days are being constantly bombarded by social media and all the stimulation. And I think at the same time, many years ago, it was other types of media that were constantly bombarding messages of like certain ways we should look or how we should live our lives or what products we should be using. So I think some of the disconnect comes from like thinking it's completely different when there are similarities there. Like ultimately, the messages that we're reinforcing as a society need to be looked at of being overly focused on this very heteronormative Western ideal of beauty and success. I think that's more what we need to see as a common factor. And when people who are older and people who are younger can kind of recognize that and talk about it in an open and curious way, that's going to help everyone instead of being judgmental or going into a conversation with like, this isn't the right thing and I'm not going to accept any other kind of opinion.
And finally, in closing, what is the one thing that you wish we remember about social media, mental health, and that we should always keep in mind so we understand what's happening and we can identify issues that can become big issues, and then we can discount those things that are not as important. So what advice would you give us?
There are a lot of things, but I think what it really boils down to is that social media is not, like I keep saying, it's not the full picture. It's just a snapshot. And even if you have to remind yourself that every day, every second, that is something that's so important to remember. And to remember that, I think the other piece is that not everything you see on social media is true, including news, including medical or mental health advice. Like, really being aware of your sources and the accounts that you follow, not just taking it at face value.
You're a professor, but also you have a practice. What is the one thing that you wish you knew at the beginning of your practice that you know now that would have been very helpful to be most proactive, most helpful into getting to the nitty-gritty of your patient's challenge?
I think the thing that's been most helpful as a therapist is recognizing that sometimes just showing up and holding space for my clients is enough. And sometimes that's all people need. Like, I think people think that therapists have magic wands and can fix them, but really, like, my job is to help someone fix themselves and improve themselves and find the path to the life that they want. So I think for me as a clinician, recognizing that and being able to separate myself from the outcome was the most helpful thing for me as a clinician and being a better therapist, and also just on a personal level and emotional level.
It's been a pleasure having you on the show, and I hope you come back again sometime soon.
Yes, thanks for having me.